Thank you for staying with us on KTN Prime. We still want to stick with matters of industrial unrest and still talking about a strike there by nurses. Now, a meeting between the Health Workers Union in Nairobi and representatives from the county government failed to bear any fruits. The two parties failed to agree on issues surrounding the legality of the union. The union leaders have vowed to continue with the strike until their grievances are addressed.
As the health workers' strike continues to bite, many Kenyans, those who can afford it, have been forced to seek treatment in private hospitals. Many others have been left with nowhere to turn. At the Pumwani Maternity Hospital, patients were left stranded as doctors who are on a go-slow decided to send some patients home.
Mimi naishi baba dogo. Nilikuwa nimekuja huku clinic, sikuwa najua nini naendelea. Sasa kufika wananiambia hawezi nihudumia juu wako mgomo. Sasa mimi ni mtu yani nafanywa operation, niko na watoto wawili na watu nilifanywa operation. Sasa niliambiwa huko clinic penye naendanga nikifikisha 7 months nikuje nifanye booking huku, juu huku ndio nitajifungulia. Sasa kufika wakaniambia hivyo.
A scenario that repeated itself at the Mbagathi Hospital, where some wards were left unattended because the few nurses present could not cater to everyone.
We are willing to negotiate because it's only what we are asking is about salary increment. We are only asking for promotions, and we are asking for equal remuneration. Because why do you promote these ones and leave these ones? And we are working in the same umbrella.
As far as the harmonization process is concerned, I don't think this is really the responsibility of the county government. This is the responsibility of the public service, the national public service, and the county public service. And it is a process.
As the strike entered its day 2 here in Nairobi, a meeting between health workers and representatives from the county government ended on a sour note. A disagreement will ensue between the two parties, leaving the nurses with no option but to stand firm on their ground. The strike, they say, will go on.
The county brought a set of lawyers. They are asking for legality of this union, and they are asking why we are representing the clinical officers and all the healthcare workers.
The situation was, however, different in Meru County, where patients had every reason to smile after health workers called off a week-long strike. This following an agreement with the county government. But in Nyeri County, hospitals remained deserted as health workers chose to stay away from the hospitals.
When they said that we had refused to sign the return to work formula, that one was not ours.
The striking health workers have vowed not to give in until the government resolves their grievances, which include issues of delayed pay and allowances and hiring of more nurses. Fatma Pole, KTN News.